let's just do this right now, and Grandma will play with you.
Nancy Fleming never really felt sick, so she didn't think having high blood pressure was very serious. Then she came to Kaiser Permanente Colorado and met her new physician.
And she said, do you know, this can be a stroke waiting to happen? And I went, really?
Nancy is just one of thousands of Coloradans who today are healthier because Kaiser Permanente focused on excellent high blood pressure control.
Our control rates were better than the national average, but they weren't phenomenal. And we had lower rates of heart attacks and strokes, but now we've got tremendously lower rates. And it's in part because we've been able to see the years of better control.
Since January 2008, Kaiser Permanente Colorado has improved its blood pressure control rate from 61% to 82% in its hypertensive patient population. That's more than 10,000 additional patients with their blood pressure controlled. Kaiser Permanente did it by making everyone part of a team effort led by physicians. Using electronic medical records, staff created registries of patients with a hypertension diagnosis and blood pressure readings above goal.
We can use that registry to develop lists that allow us to proactively outreach or identify patients that do not have a blood pressure that is at goal.
Outreach included follow-ups with patients by email or phone, sending a personal message about their blood pressure.
Perfect. So that sounds like you're at your goal of...
Clinical pharmacy specialists monitored medication and collaborated with primary care physicians to make adjustments as needed. Everyone watched as blood pressure readings improved.
Put your feet on the floor.
Nurses and other medical staff played a vital role by using correct techniques to take blood pressure. They also emphasized healthy lifestyle changes with patients.
They're not just putting a patient in a room. They're not part of a factory. They're part of healthcare. And so this makes them love their job. They feel like they're doing something important.
Shh. Good night, excavator. Good
Kaiser Permanente understands that no team is complete without the patient. When Nancy Fleming decided to get serious about lowering her blood pressure, she always knew her physician was rooting for her.
Every time I went in for whatever I went in for, she was right there cheering me on and saying, you're doing this. This is looking great.
Kaiser Permanente also made it easy for patients. They eliminated co-payments for blood pressure checks, and patients could drop in for a reading, no appointment necessary.
Okay, that's very good.
The strategies that Kaiser Permanente used are sustainable and doable in smaller organizations.
As long as you set up a system that works in your office, a paper reminder system, lists, start generating lists as folks come in, do small steps at a time, learn from one effort and then augment that for the next effort, you can do this.
Today, after making many changes to her lifestyle, Nancy Fleming's blood pressure is under control. She believes Kaiser Permanente saved her life, and she is very grateful.
Oh, more than I can say.
The model of Kaiser Permanente could be a model of success for the whole nation. Proactive, patient-centered, integrated care.
Kaiser Permanente Colorado did it, you can too. Follow their leads and help Million Hearts achieve its goal of helping 10 million more Americans get their blood pressure under control.
Million Hearts is an HHS initiative to prevent 1 million heart attacks and strokes by 2017. Thanks to Kaiser Permanente Colorado, Nancy Fleming could be one of those million.